Hey everybody, Chris Bailey here with Physical Therapy and Balance Centers, and today I'm going to be going over some common problems that we see with the hip and some basic anatomy for the hip. So when we talk about the hip, it's a ball and socket joint, and this is just a model of the spine in the pelvis. But at the bottom of the pelvis you have this little socket right here, and it would be deep, actually about 6 inches deep into my hip right here is where this is. And in this area here you have the upper leg bone, the femur. And what that does, it kind of angles inward like this. So this is the socket, the upper leg bone angles in and ties into there. So when I'm pressing on this area right here on the outer part of my hip, this is not really my hip joint. It's more the outside called the greater trochanter out through here that you're pushing on. So the hip joint is quite a bit deeper, and that confuses some people. We see some problems a lot of times with some of the muscles where they attach right through this area. So it'd be on the outside of the hip here. Some of those glute or butt muscles attach into this area and can create a tendonitis, a pain in through here. We see bursitis, and what that is, there's a little fluid-filled sac that acts as a little bit of a shock absorber in through this area. And when certain structures get tight and compress that, they can create pain on the outside of the hip. The other issue we see quite a bit is what we call hip impingement. And that just means sometimes you could have a little bone spur that comes down off of this lip of the hip joint, and it can pinch in through some of the muscles or onto some of the bony structures as that hip moves. The other thing that we see is generalized hip tightness. And what we're starting to learn through a lot of the studies is that if the hip socket itself is tight, we see this a lot of times in guys above about 55 or 60, those have generalized hip stiffness. When you see that, they start to lose the mobility to be able to lift their leg and move it in different positions, and it compresses the ball into the socket. So if you have some mild arthritis or some mild bony changes into the hip, you can have quite a bit of pain just from that tightness that's going on in through the hip and the surrounding structures. The other thing we see a lot of times are muscles that get tight around this area that can also create more tension and pressure into that hip joint. You can have tightness in through the hip flexors in through here. You can have tightness of some of the butt muscles, one in particular called the piriformis we hear about quite a bit, and through the back. And all of those lead to compression into that joint. The other big thing that we're finding in some recent studies is that if the hip is stiff, it's one of the main causes of back trouble. Because if you can't move your hip properly, all that energy just transfers up through the pelvis into the spine and creates more torque into the spine. So oftentimes one of the main treatments we do for low back issues are to make sure that the hips are moving as well as they can, because that really helps with the low back. Sometimes people have exhausted all their efforts worrying about what to do with the low back, but the hips are so stiff, that's what's causing this issue. The other thing that hip issues do, especially hip weakness, is they create a lot of knee issues. If the hip muscles, especially the glute on the outside, gets weak, you'll see people kind of walk like in this pattern here. If that muscle is weak, it supports not only the hip joint, the back, but it also supports the knee. So we do a lot of strengthening on this hip joint in through here. So if you have pain on the outside of your hip, on the inside of your hip in through here, or you just notice limited mobility, difficulty tying your shoes, bringing your leg up, sometimes pain in through the butt area in through here, check out our Active at Home series for the hip. I have some of our best stretches and strengthening tips to work on some of the muscles I just talked about, both to strengthen the ones that are often weak, stretch the ones that are tight, and give that a shot for a couple of weeks. If you still notice you're having your problem, pain, stiffness, tightness, difficulty with your daily activities or work, give us a call. We'll take a quick look at the hip and the low back and determine the real source of your trouble. So please reach out to us with any questions, and I hope to hear from you soon. Thanks.